practices can be profitable, they can be efficient, and that can all be lovely, but they are worthless if you have patients that are lost to follow-up or never come back again. So obviously that depends on your subspecialty, but if you're not bringing in new patients or you have no idea what your new patient load is and you aren't retaining the ones you have, obviously your practice is going to stagnate and decline. So today we're going to explore the 3 metrics that will help you achieve results that allow you to understand if your practice is growing, how fast it is growing, and if you need to change that or change how you're getting patients in the door in order to, again, hit those profitability targets. So today, before we dive in, I do want to mention that a lot of the concepts we're discussing today are kind of part of that bigger picture. So obviously, we have a couple resources for you guys down in the show notes. We have that margin protection playbook, quick, dirty, patient AR, a couple tips, and then a deeper dive on eligibility training and checklists that your facility can use in order to make sure that you've got eligibility at the front desk hammered. So head on over to the show notes in order to click those links and download those resources. All right, so let's get into some of those powerful numbers to incorporate into that monthly review. This is a part 3 of our part 3 series. So today we're going to be talking about those metrics that, again, allow you to understand how well your practice is growing. So again, if you've set those benchmarks around how many patients you need to save per day, you're monitoring, the percent of those patients that are seen each day with each of your different providers. And now you're trying to understand, okay, I've got all these revenue generating activities and I'm trying to figure out, are they working, right? And so the first metric is new patient volume, right? Not rocket science. Again, this is building upon the metrics that you need to monitor. So this may not be the first metric you measure. So again, go back to that part 1 of our series. Start slow on these, but if you've started tracking the other two podcast metrics, now this is another one to add and build upon. So new patient rate, right, is the percentage of your total patient visits that are from new patients. So in plain English, right, measure of how well you're attracting new people to your practice. So obviously why this matters is that you want a stream of new patients for your business, right? So depending on your subspecialty, you may need 15 to 20%, for example, maybe in an OBGYN practice to target, right? Now you can have lower rates depending on the lifetime value of your patient, right? So if you are a subspecialty like cardiology and maybe you have a long list of your patients that you see every 3 months, then this target may change. And so you can identify some targets to aim for depending on your subspecialty and research that so that you can hit and understand what that target is. Also, that target may be higher for a new practice and lower for an established practice. And again, this comes back to what are your goals for your practice, right? What are your revenue goals this year? What is your profitability goals? What do those 2 things look like today? And then you can start saying, okay, well, if this is my revenue goal and this is how much I'm getting paid per visit, and this is the number of visits I do per month now, what is that gap? Okay, that gap is in an additional 100 patients per month that I need to see. Then you use that to set a healthy target for new patients coming into the office. And then you're tracking that month over month. So then you can say, are my marketing efforts working? Okay. And again, you'll feel it in your practice, but seeing that number on a spreadsheet month after month is a clear signal that it's either working or that there's an opportunity to improve referral relationships, ads for marketing, or maybe it's just your online presence and content creation. And so again, really great to track this number. We track for a lot of our practices the volume of the new E&M codes. And so then they can use that as part of this evaluation. I highly recommend kind of creating this dashboard that you can start tracking these types of metrics. We've started playing around with a dashboard that you can enter your metrics into. And so this is something that we're hoping to publish out for folks to use by the end of the year. All right, so levers to pull. Obviously, referral network. How do you currently get patients, right? Is it through a podcast, or is it through referral relationships with primary care offices if you're a subspecialist? What does that look like? How do you track that information? And again, for more established practice, for practices that are really focusing on growth, these are the things that you need to think through. And it may not be you, the owner, who's managing this, right? You may have a part-time revenue growth operations manager. And again, that person can be remote, and it can just be the person who's helping track and identify, where do you currently stand? Where do you need to be? What are your targets? And they're working with your financial person to help set those metrics so that you can continually know, okay, here's where I'm at. Here's where I need to be for this year. Am I hitting those targets? If not, okay, what levers do I need to pull? So obviously, that referral network, if you do have that as a big part of your strategy, then how are you building those relationships? How are you reminding those relationships that you exist? And is that with primary care physicians, pediatricians, other subspecialists? If you have a physician who's, say, newer and slow, are you sending them out into the field to go knock on doors? Again, some, kind of different tactics, but important tactics. Obviously, I'm a big fan of podcasts. We do a podcast for our business. It's been probably 90% of where we get our business. Obviously, as we've been along longer, we get more referrals, which is great to see. It means people are happy. And that's another thing, patient referrals is another thing that you can make sure that folks were reminded of, right? So are you reminding patients through an email list or through some sort of notification that says, hey, if you like our service, we're looking to grow. We have a new physician who's in the office. We'd love to see, if you have friends to recommend us. So again, these are things that you may think of, but it may be worth writing down, okay, what are all the strategies that I use to get new patients into the office? And then rate yourself. How well am I doing at these? Which ones of these do I want to focus on this year? And then how do I use those to track the metrics of new patient volume, new patient rate that we have currently in the office? So again, I'm a true believer that if we're not measuring something, it's hard to monitor it. It's hard to impact in your practice. So really important key metric for you to look for. Also asking for reviews. Making sure that your patients know to leave a Google review. It's oftentimes that the patients who are really upset go to use those platforms. So you do want to make sure that your happy patients are also using those platforms. All right, metric number 2, patient retention rate. So this is the percentage of your existing patients who return for another visit within, some specific time frame, right? So for primary care, that may be 12 to 18 months. Basically, it's just a measure of how well you're keeping the patients you already have. And you could even look at the lifetime value of patients. So that's looking across your practice if it's, 5-10 years old, and understand, okay, how many patients, do I have? And what is the cumulative revenue that a single patient brings in? And can you look at that across your practice just to understand how much is a patient worth to your practice? Lifetime value is a very common thing that businesses in general manage and measure to. And so just one other way for you to look and understand practice profitability is really understanding that lifetime value. So obviously, it is always more expensive to acquire a new patient than it is to keep an existing patient. Obviously, for some practices, you may be a subspecialty where it may be a one and done sort of thing, where they come in once, you solve their problem, and maybe they don't come back again for several years. So, certainly recognize that this is practice specific. But for a lot of practices, you are seeing those patients every year. And if you're not seeing them every year, but maybe it's every 2 years, then is there an opportunity to call those patients at that 1 year mark and say, hey, just a reminder, you're due for your annual. And a lot of patients need that reminder. For me personally, I am not great at remembering when I went to the doctor last. And so if somebody's calling me and saying, hey, it's time for your 6-month skin check, or it's time for your annual, it's like, okay, I'll make that appointment and prioritize that. So obviously, levers to pull here for you to think through is when you do provide an excellent patient experience, which I know all of you are, from the moment that patient calls to the moment that they leave, every interaction is part of what they remember. Is your staff friendly, helpful? Are your wait times reasonable? Do you have a good process of explaining what's going to happen with invoices? Do they feel confident that when they're paying those invoices that they're accurate? So obviously all of that results in then a positive feeling about your practice. Asking them for reviews and referrals is a big part of that. The other thing to do is automated system, right? Reminding patients that they're due for those follow-up visits. Really key here to make sure that you're retaining those patients and seeing them. Another great thing that we've seen many of our practices do is a monthly email newsletter. They share valuable health information. They're staying top of mind with their patients. And they're also giving something their patients can share as a resource to family and friends to, again, remind them to share and bring new patients in that may be local to your area. All right, metric number 3, we talked about this a little bit already, patient lifetime value. So again, that's that total amount of revenue that you can expect to generate from a single patient over the entire course of your relationship with them. So again, this is that long-term financial value of each patient. And why it matters is that you can have a single patient, especially in an OB practice, that's generating a lot of revenue for your practice, right? They could have prenatal care, delivery, annual exams, problem visits, menopause management. And so your LTV helps you make smarter decisions about marketing, patient acquisition, and retention, right? How much are you paying to get one patient? And do you make sure that you get that money back from a marketing perspective in order to have an ROI on that patient? So levers to pull here is, can you offer new in-office procedures or consulting or nutritional counseling or cash-based services to increase the value of those patients? Again, with the thought in mind of, okay, if it costs me, I'm making these numbers up, $1,000 to get a patient in the door in a single month, right? If you're spending $10,000 in ads, hopefully nobody is doing that, and you only have 10 patients coming in per month, that's $1,000 per patient. And if you never make that up in the lifetime of that patient, then you know that your marketing is not going to be sustainable long term, right? And so you have to start thinking about this just like a business would, right? Because we're all businesses, and be able to identify the amount of money that you're spending to get a single patient in the door, and then how long does it take for you to recoup that investment. So that's why these numbers are important. So it allows you to understand if the strategies you're using are going to help sustain a profitable practice down the line. So obviously, another thing here is identifying types of patients who have a higher LTV, right? So we have a podiatry practice, and she knows which of her patients are more likely to pay for cash services. And she knows them by payer. She knows them by demographics. And so then it allows her to have targeted marketing campaigns and attract more of those specific types of patients, right? Because they have a higher LTV, lifetime value. And so if you know what your lifetime value is of different subsets of patients, that may change who you market to or what services you offer. Again, with driving up that value or the revenue within the practice and therefore profitability. Obviously, building long lifetime relationships is the single best way to increase LTV. Reminding them of their annuals, having them come in over and over again, renegotiating those payer contracts, pushing up again the value of that patient. Is going to be key here. And so understanding that lifetime value, again, these are a little bit more in the detail, in the weeds metrics, but again, as you're growing your practice, these are all levers that you can understand. So you can understand, how much am I spending on marketing? How much am I spending to get those patients in the door? Are they staying long enough to recoup that? Is really, really important. So again, key metrics here that again drive that practice growth are new patient rate, patient retention rate, and then patient lifetime value. So obviously tracking these is important. You move from a state of uncertainty in terms of one where you know that you have healthy, sustainable growth and that you clearly have a good ROI when it comes to your marketing and how those patients are coming in the door, how often they're coming in the door, and how long you're keeping them. So from an action plan, right, similar to our last couple episodes, these are metrics that are a little bit more nuanced. I would say more for advanced practices who've kind of already done the other metrics. So again, for the next 30 days, track these 3 metrics, right? What is your current new patient rate? And it may be a 60 to 90 day period for these types of metrics. What is your patient retention rate for the last 3 years? What is your estimated patient lifetime value? And then how does that compare to your marketing in order to get those patients in the door, right? So if you're bringing in 10 patients per month that are new, what are those marketing things that you're doing to get them in the door? And then how much are you spending so that you can start thinking through on that. Now, there are some more advanced metrics that you can monitor, like CAC, which is cost to acquire customers and so forth, that get further in the weeds. But again, as you become more advanced and as you grow your practice, these are the metrics, just like any other business, that you want to track and trend so that you really understand. And again, this may not be you, the physician owner, but this may be part-time contracted individuals who can help you really identify your biggest opportunity, monitor these every month, and help you get to the point of where you're trying to go. So again, pull one lever at a time, implement things that are new in order to drive, again, further progress with where you're trying to go with your practice. And hopefully these tips helped and that you guys enjoyed this 3-part series, kind of stepping through revenue and in the weeds, kind of efficiency in the office, and then obviously some profitability growth metrics, again, that can kind of round out a practice. These aren't the only metrics to monitor, but are 9 metrics that I think are really important. As always, if you are looking for a new revenue partner, we would love to meet with you guys. You can head over to our website, natrevmd.com, go into the top right-hand corner and see if you qualify for a free billing metric review. And as always, happy to hear from anybody who's looking for different topics. You can email us at info@natrevmd.com. All right, have a great week.